Hi, my name is Megan Morris, and I am an abdominal and pelvic health physical therapist with Kitsap Physical Therapy, and I'm here today chatting with Kara, who is also an abdominal and pelvic health physical therapist, about what got her interested in this topic to study. So, if you don't mind
thanks,
sharing
Megan.
a little of your story.
So for a lot of you behind the screen, you might be thinking to yourself, well, what the heck is an abdominal pelvic health therapist? Basically, we're your TMI physical therapists. We treat pee, poop, and periods. And for me, getting into this, we have to go back in time to about 14 years old. I was a competitive gymnast practicing about 20 to 22 hours a week, so it was pretty stressful as far as managing education and school and practice and competition season and all of that. And so around 14 I got my period. So now add in, body image issues already. We're in leotards, and I'm now trying to figure out, okay, do I wear a tampon or pad, and God forbid, do the little flaps or the strings come out during my floor routines or my switch leaps. So trying to navigate that was quite interesting. And then on top of that, at the same time, started to notice that I would pee when I tumbled. And so fortunately, we were a close-knit group that I could ask my other teammates, were they experiencing the same thing? And thankfully for me at the time, I wasn't abnormal because it was happening to them too. And so we more or less just mitigated that by either wearing pads or bringing an extra pair of shorts to practice. And thank God our coaches chose black crushed velvet for our competition Leos because it didn't show. We could make plenty of trips to the bathroom to dab in between. But it was pretty challenging to navigate. And so then fast forward into PT school, we had an awesome guest lecturer come in and talk to us about women's health and pelvic health. And at the time, had the light bulb go on and that aha moment, the angels come down, that I wasn't abnormal, that it happens to others, and it wasn't just gymnasts, that it happened throughout lots of phases of a female's life. And so then I just became very inspired to be a part of the revolution to change what is considered normal and accepted throughout healthcare related to women's health topics. And so that's kind of where we are today, and me even kind of extending the invitation out to you guys to be a part of the revolution, and to have you and your daughters know that it's not just normal, that there are things that you can do about it, and being able to lean into that discomfort of the embarrassment and know that there are providers like myself and Megan out there to help you, and that it really starts with you and your daughters, and that we can rewrite this normal. So it's pretty awesome to be a part of where we are in women's health.
Mm-hmm.